Hi, I'm Steve Latham at the Yale Interdisciplinary Center for Bioethics, and I'm speaking now with Daniel Tygard. Daniel is teaching in our Summer Institute. Why don't you tell us a little bit about your educational background, Daniel?
Yes, so my background's in philosophy. My BA was from the University of Washington in Seattle, and then I went to do my master's at Brandeis University just outside of Boston, and then down to Tulane in New Orleans, where I just finished up my PhD on the issue of moral distress in medical practice.
And say a little bit more about moral distress for people who might not be familiar with it.
Yes, so it's typically addressed in the nursing literature. I do take it to be a broader phenomenon, and it's often associated with a lot of undesirable effects, namely shortages in various healthcare professionals. And what I wanted to do was provide an account of what moral distress might be by invoking some theories about the moral emotions. And then I also wanted to challenge some of the prevailing assumptions that moral distress is purely a negative phenomenon. And so there I wanted to invoke some contemporary theories of moral responsibility and really investigate what it means for someone to experience moral distress, because it seems to me that it's not just a bad thing, but it also might tell us something important about our character.
So what's a paradigm case of someone undergoing moral distress?
Well, typically in the literature, we see things like a healthcare practitioner who is unable to do what they believe to be morally right. It might be due to some sort of institutional constraint. So it looks like they're facing some sort of moral conflict in the sense that they're forced to do something that they believe to be wrong. And it's this sort of phenomenon that causes a great deal of suffering. So practitioners are often cited as losing sleep at night and leaving the profession entirely because of this. And so I tried to walk a pretty fine line in my dissertation between saying, trying to recognize the negative effects while at the same time recognizing that the experience of moral distress itself might indicate that we are morally sensitive creatures.
Right, that we have good enough character to be distressed by these kinds of circumstances.
Precisely, yeah.
So what is happening next for you academically in your career?
So this is, I've recently been accepted as a 2-year postdoctoral researcher at a German university by the name of Aachen. And so the project I'll be working on there for 2 years is also on moral responsibility with respect to emerging technologies. So I have things in mind like autonomous weapons, social robots, our use of big data in domains like healthcare and social media. What I have seen in a lot of very recent literature is a concern for moral responsibility in emerging technology, and often a skepticism that we can have anything like moral responsibility in these domains. And so it occurred to me that some work needs to be done in trying to carve out what that might mean to have anything like moral agency with our use of technology, and how, if at all, we can have responsibility when it comes to those domains.
So what are you teaching in our Summer Institute?
Yeah, so I teach a seminar on responsibility and moral conflicts. And so this does speak a lot to my dissertation with respect to establishing what it means to be a morally responsible agent. And then we turn to kind of a range of different sorts of conflicts. So we look at moral dilemmas, the problem of dirty hands, and cases of moral luck. And it looks like all of these sorts of conflicts might somehow undermine our status as morally responsible agents. So the question then is, what do we do? And to what extent are we still morally responsible for those actions and decisions that we make in those really, really difficult decisions? So that's how I set up the course.
Do you look at literature of moral emotions?
Yes.
Yeah.
Absolutely.
Yeah.
So kind of that neo-David Hume literature on the sentiments and their role in determining our responsibility practices.
And how do you find the students?
The students are wonderful. Yeah. One of the things I really appreciate about the students here, I mean, they're coming from all different backgrounds in terms of their academic fields. We get to interact with those who are coming from more philosophical backgrounds. We've also got the more practically minded who are either in med school or are already practicing medicine and want to think more about the ethics of their practice. Of course, we've got law students, and so I just like the very dynamic interactions that we have. And I like that they're coming from all around the world, so I get to connect with people from all around the world and develop colleagues and really develop some meaningful relationships.
I'm smiling because I ask this question of everyone, and everyone says exactly the same thing. And,
it's true,
and it's just true. Yeah. How about the colleagues that you have here? Have you been working with people here?
I have. So one colleague that I've met here works at a hospital down in Israel, and since I've been living in Vienna, I've been meaning to make a trip down there to see him, and he's recently invited me to come speak on the issue of moral distress to some of his colleagues at the hospital there. So that's certainly something I intend to take him up on. Then there's also Olya Kudina, who works in some areas that are very similar to my upcoming project on technology and the ethics in emerging technologies. So we've had some very fruitful discussions, and I definitely imagine those will continue beyond here.
And she is located at Twente, which is very close to Aachen, so
Yes.
you'll be able to see each other.
Yep, right across the border. So in fact, I understand she's organizing a conference, upcoming conference, and so we'll all be able to share some ideas that we've been talking about here and carry those forward.
Great. And so what brings you back? I mean, this is your second time teaching?
That's right, yeah, second, and I hope to continue that. Yeah,
So why? What's the big benefit for you?
yeah, there's just such a positive, productive atmosphere. I just feel like everyone here really wants to be here, and everyone's just always just consistently excited to interact with each other, and so it's inspiring. It really gets me to want to work more on my own work, but also just engage with others and see what they're working on, because I find it personally enriching and inspiring.
I have to agree, because with my job, as with lots of people's jobs in bioethics, if you're a university bioethicist, you are often the only one, or maybe not the only one, but one of very few.
Yeah.
And it's really unusual to have, in my case, 30 or so international colleagues who work in bioethics to come through in a couple of the summer months. It's really an amazing kind of gang to get to be a part of.
Yeah.
And it's terrific that we now have so many people coming back year after year. It's really becoming a kind of solid community of a lot of the really great leading, mostly junior scholars in the area from around the world.
Yeah.
So it's very exciting.
It's nice to establish those relationships at this point in our careers, because I see a lot of just young scholars that just are going in so many really awesome directions, and so it's going to be really fun to see where everyone takes their careers, and so it's nice to have these relationships established at this point.
Well, that's great. Well, congratulations. I know the
Thank
news
you, sir.
about Aachen is very recent.
Very recent.
So that's a wonderful opportunity you've got. Congratulations on that.
Thank you, sir.
Thanks for sitting and being interviewed.
I'm glad to be here.
All right.
All right.